Welcome back to Hilaal Live. Now, the National Assembly has passed the contentious National Health Insurance Bill, paving the way for universal health care. While the bill faced opposition from several parties, it passed with 125 voting against the bill, with 205 voting in favor of it. Joining us now to discuss this is the Health Department spokesperson, Foster Mohale. Mr. Mohale, good evening and thank you so much for joining us.
Good evening to you and good evening to your viewers at home, and thanks for this opportunity.
Mr. Mohale, it was a long time coming, wasn't it? The inevitability of the NHI bill was always going to be there.
Yeah, look, I know there are mixed reactions since the National Assembly has passed the bill, which is currently being sent to the National Council of Provinces, which is known as the NCOP. But we understand all these concerns raised and the mixed reactions. But what we want to assure South Africans is that we are working on the program which is not only South African, but it's globally, which has been endorsed by the World Health Organization, which is called Universal Health Coverage, whose intention is to ensure that all people in the country, they are able to access they are able to have equal access to quality and affordable health service, regardless of their geographic location, regardless of their socio-economic status. So mean that whether you are poor or rich, whether you are old, young, whether you come from urban or rural, whether you're coming from informal settlement, we are trying to address the imbalances that were imposed by apartheid government in the country. As we know that South Africa is one of the mostly divided country, unequal country, precisely because of a number of factors. Number one, the level of unemployment, the crime rate, and all other challenges. So we have done this in the education sectors, where we are able to introduce what we call the NSFAS, where people are able to study wherever they want to study as long as they meet requirements. So the issue of saying, I'm coming from a family of unemployed parents, I'm coming from rural areas, is no longer applicable. As long as you meet your requirements, you'll be able to go to your higher education higher education institution of your choice. So we are trying to level the playing field between the haves and the have-nots, because they are about 84% the have-nots and about 14% of have. So we are trying to ensure that we've got equal access to quality and affordable healthcare, because when we are suffering from disease, the disease has got no discrimination. The disease has got no boundaries. So just like you saw during the COVID-19, all of us were equal to COVID-19 vaccine. So we didn't have a COVID-19 vaccine for the rich or for the poor. So all of us, we had to go through the same channel in order to access COVID-19 vaccine. So we want this to be applicable not only during COVID-19, but across the board, because the mission of the National Department of Health is to achieve a long and healthy life for all, must underline the word, for all South Africans, not for few.
Mr. Mohale, I want to talk of blueprints of NHI. We saw in the UK they've used the NHS system. So how is the department trying to at least use some blueprints internationally to implement it right here in South Africa?
No, definitely, this has been piloted and it's been developed. It's at different stages in different countries across the world. Of course, we are only considering what has worked for other countries. For example, look at a country like Cuba. They've got one health system. There's no health system for the rich. There's no health system for the poor. So we are trying to learn from the best. Where there were some challenges, of course, we know the challenges, but also try by all means to ensure that we don't fall into the same traps that other countries have fallen. So, but think of countries like US. I think they have successfully implemented a similar program called Obamacare. So we are closely following and learning from the best in order to avoid committing the same mistakes.
Mr. Mohale, implementation, Dr. Joe Butler, the Minister of Health, said it's going to take some time. So in terms of its implementation, what is the period that the Department of Health, along with national government, looking at to actually have a date in which NHI officially starts?
Yeah, the date is going to be informed by the parliamentary process. As you know, that it moved from the National Assembly. They took their time to process the bill. They summoned us several times to appear before the parliamentary committee on health in order to clarify certain issues. They even allow stakeholders to come and make the inputs on how they can make sure that the final product is a product that will resonate well with the majority of people, because it's always difficult to say this will resonate with almost everybody, especially political parties. You know that the role of political parties is mainly to oppose. It's rare where the political parties, all of us, they can agree with the ruling or the governing party. So we understand, but we say all of us, they agree in principles that we need to improve the quality of healthcare in the country to ensure that the poor can also can survive and access this quality healthcare. So, but also we say anyone who has got the reservations, concerns, instead of criticizing, just come closer to us and assist us, make the inputs. Hence, we say people must exercise their constitutional rights to participate in the decision-making process in Parliament in order to ensure, at the end of the day, what's going to be signed by the President into a law is something that the majority of the stakeholders will agree. But the fact of the matter is that it's rare where you can produce an act, a law that almost everybody will say, yes, this is, we all agree with it. People will always have their own reservations. But the majority of people, as long as they agree that we need to ensure that we improve the quality of healthcare for everybody, not for few.
Mr. Mohale, I think both you and I can agree that our public hospitals are not in the best space at this very moment. So where do the public hospitals fit in the NHI? Because what we don't want to have is a white elephant with those public hospitals, and then obviously we have the NHI and its movement towards private healthcare. So the role of public hospitals in NHI, and first of all trying to make sure that these public hospitals are functioning, and not just functioning properly.
Yeah, no, definitely. We understand that some of the challenges that we experience as government with regards to the infrastructure, the health facilities in the country. Majority of them, of these hospitals, were built long time ago, as long as before democracy in the country. But we have been developing the standard at which all the health facilities must comply in order to ensure that they contribute in the success, in the well functioning of NHI. Yes, we are working, we are developing, we are building new facilities where there's a need, and also upgrading the current facilities. But also, what is more important is that one of the first priorities when we want to implement the NHI is to firstly to work closely with the private healthcare sector to open doors for our ordinary people who will hardly have access to such hospitals, private hospitals, GPs, because we always know that they need money. So we say, please open the doors for these people who don't have financial means to access better and quality service. The government will pay. They are not just coming there for pro bono, but as the government will say, allow them, but we'll be able to pay, while we are going to continuously improve the current infrastructure that we have in the public sector.
Mr. Mohale, I think both you and I know that the medical aids, the private medical aids, will obviously have something to say about this. How is the Department of Health facing, of course, the backlash, if it hasn't already started, from the medical aid companies that exist here in South Africa?
Yeah, no, this is a consultative process. We won't take any decision without consulting those who are going to be affected by these new changes. And so there's a saying in English where we say, please don't decide for us without us. So there's nothing for us without us. So even in this case, we say we will not make any binding decisions on the side of medical aid schemes without them getting involved. But what's more important is that all of us, we are working towards achieving a common goal, which is to improve the well-being, the health of all South Africans, regardless of their deepness of their pockets, geographical location, or in simple terms, socio-economic status. So we are going to closely work with them, say, let's see how we can work together, all of us, so that we've got one common objective.
One final question, Mr. Mohale. Does the NHI open for the possibilities of more job opportunities for our medical practitioners in this country?
No, definitely. Especially, remember, for example, let me give you an example. A majority of GPs that will find in rural areas, in towns, I don't think they see as many patients or clients as they would be seeing during the time of NHI. For example, some of them, because we know that the level, because of the level of poverty, some of them we find that per day they can see up to 10 clients, because majority of people, they rely on primary healthcare, which is clinics that are located in our communities. But once we implement the NHI, it means they will have a choice. Ordinary people will have a choice to go to the nearest general practitioner, private hospitals, and the specialist without paying. So meaning that they're going to more money than what they're doing now. Of course, we need to see on how, in terms of the rates, on how they're going to charge us, and also how to manage this process to avoid a situation where people end up claiming for people to not come and consult.
Mr. Foster Mohale, we say thank you so much for joining us.
Thanks very much for this opportunity.
That is Health Department spokesperson, Mr. Foster Mohale, talking to us from a health department perspective on the implementation of the NHI. Do stay tuned to Hilaal Live after the break. I'll have your latest in news.